Well, this month especially, we are paying special attention to heart disease. It is our nation's #1 killer. It is so important to know the risk factors and the signs and the symptoms. Today we have Dr. Shoba here to tell us what we need to do to protect ourselves and our family. And Dr. Shoba, it's always good to have you on the show.
Good to be here, Amy.
And certainly wearing our red this morning as we celebrate and raise awareness of heart disease.
That's right. February is Heart Month. 1 in 3 of us is going to die of a heart attack or stroke. And it's a gentle reminder that we need to take care of our hearts starting today.
Starting today, making that commitment.
Making that commitment. And wearing red in February, it's a pretty color.
Yeah.
Stands for the heart, just as a reminder.
Which is one of the things that we wanted to talk about too when we talk about Heart Month. It works great because February also we celebrate Valentine's Day.
Oh yes. Did you have a good Valentine's Day?
It, you know, snowed in, but it was nice. We crashed the kids' party actually. We didn't get to go out. But we were talking about broken hearts, and you say that actually can lead to heart disease. You've got to be careful.
That's right. When we talk about Valentine's Day, we think about hearts, and then that leads to broken hearts, and we croon about achy, breaky hearts and dying of broken heart. But you know, actually broken heart is a medical diagnosis. You can actually die from a broken heart syndrome. What broken heart syndrome is, it's actually a type of heart attack where the heart muscle actually does not move well, but it is not caused by a blocked artery. Our heart is like this fist-shaped structure that is like a pump that pumps blood. But it has got these spaghetti-sized blood vessels that supply blood to the heart. And when you have a clogged blood vessel, you have a massive heart attack. Broken heart syndrome is different in that you have no blockages. The heart just suddenly has a heart attack, and you have all the symptoms. You have the chest pressure, you have the shortness of breath, your heart enzymes are elevated, your EKGs are abnormal. But when you do a procedure called a heart catheterization, you find no blockages.
So, which is really interesting because when you hear somebody going in, that's one of the first questions you ask is how blocked was it?
Correct.
So there are cases where there is no blockage.
That is correct. This condition is more common in women, usually in their 60s, you know, postmenopausal women, but men can have it too.
Okay.
And one of the biggest precipitators of this broken heart syndrome is stress. And it can be either emotional stress or physical stress. Somebody has had a sudden loss in the family, or they're exposed to sudden exertion that they're not used to. They can suffer from broken heart syndrome, or they can be physically sick in other ways. So stress of any kind precipitates broken heart syndrome. But the good news is, if you have good family support, you have good friends, you know, actually you heal. Your heart muscle can completely come back to normal within a few weeks.
Wow. So that's some good news there.
That is good news.
All right, and then we have Life's Simple 7. These are 7 things that you need to be aware of when it comes to prevention, and we're going to start with blood pressure.
Right, and these 7 steps are simple things that you can do at your level on a daily basis to kind of check for your risk factors for heart disease as well. Okay. We talk about blood pressure, and just checking your blood pressure, whether you do it at home or whether you do it in one of the grocery stores or pharmacies, or whether you go to your doctor's office and get your blood pressure checked, you want to keep your blood pressure under control. And a key thing to keep your blood pressure under control is your salt intake. So be careful with how much salt you take in.
Watch that sodium. And then your blood cholesterol.
Right, and it is important to get your blood cholesterol checked because cholesterol is the stuff that clogs the arteries of your heart. And the higher the levels, the higher the chance of it clogging. But in some people, you can have a normal cholesterol and still have blocked arteries because all the cholesterol that you have is the sticky kind. Okay. So if you have a strong family history of heart disease and your cholesterol is normal, doesn't mean you can stop taking your cholesterol medication, because you could have the sticky kind, and even that little bit that you have could get stuck in your blood vessels and cause a heart attack.
So it could be dangerous.
Yes.
Then blood sugar, number 3.
Right, blood sugar is what we talk about when people have diabetes. You want your fasting blood sugars to be less than 100, but you know, diabetes is a very important cause of heart disease, and it's a hidden cause, and unless you get your blood sugar and your blood pressure checked, you don't even know you have problems with high blood pressure or high sugar levels.
Okay, and then your smoking status, we know that's so important.
Right, smoking cessation is key to helping your heart, and of course you don't want to embark on smoking. We need to teach our kids not to smoke.
Don't even start. Okay, and then a healthy weight.
Right, there is a calculator online called the BMI calculator, and it tells you what your weight should be for your height. But of course, some people are more muscle than fat, and so there may be some changes in that, but overall, you can know what your ideal weight is based on that BMI calculator.
All right, and then we all need to get moving, physical activity.
Oh, that is really the key. Your heart has to get its exercise, 30 minutes of moderate activity 5 days of the week, and that should keep you healthy.
All right, and then healthy diet, and we know that that is so important.
Right, because what you put in you is what's going to get stuck inside your arteries if you're not careful. So less fat, less of the carbohydrates, just everything in moderation. There's no food that is taboo.
Right.
Just small portions. It's all about portions, and it's about burning off what you eat so you don't accumulate it over time.
And then you said the 8th one is really just back to the beginning with stress.
The 8th one is back to the beginning because the key to a healthy heart is a healthy mind. The mind and the body, the mind and the heart are totally connected. That's what broken heart syndrome is all, There is severe emotional stress causing a heart attack. It is so important to control stress, have a positive attitude in life so that you actually do not have a heart attack. You have these risk factors all along, but what causes that sudden heart attack that lands you in the emergency room? And oftentimes it is stress, be it a broken heart syndrome or be it a real heart attack with a blocked artery. I mean, even a broken heart syndrome is a real heart attack. But what I'm saying is, like a clogged artery causing a heart attack, emotional stress, physical stress can cause plaque rupture and cause the other kind of heart attack as well. So very important to control stress.
Driving
on the left lane, I tell you what. Hey,
stress.
Somebody
road
pulling
rage.
in front of you. Road rage.
Not good.
Not good.
Ken Heath. All right, Dr. Shoba, some great information. Thank you so much for joining us. Always a pleasure to have you on the show.
Good to be here, Amy. Thank you.
Here's a website for more information, heart.org, more on the risk factors and what you need to know.